Welcome back to Vox Markets. Today, I'm delighted once again to be joined by Mo Khan, CEO of hVIVO, the company behind cutting-edge human challenge trials. hVIVO this morning released their unaudited full year 2025 trading update, showing some solid progress and a confident outlook. So, mate, great to have you with us again.
Thank you for having me on.
No problem at all. So let's dive straight in. Revenue looks in line, EBITDA actually ahead of expectations, which is fantastic. Can you walk us through the highlights?
Yeah, absolutely. So 2025 has been a challenging year for us amongst other CROs in the industry. But I'm pleased to say that we have a pretty strong trading update here where we've met or beaten a majority of the key financial parameters. So as you say, revenue, we met expectations. We expect to generate around 46.7 million pounds of revenue for full year 2025. On EBITDA, we expect to report a single-digit EBITDA margin profit, whereas we previously reported that we might make a low single-digit loss. And the key reason behind why that has shown improvement really is the improvements in Q4 operational delivery, some of the cost-cutting measures we implemented early on, and also because of the number of cancellations we had in 2025, which result in the non-refundable cancellation fee being recognized as revenue with very low associated variable cost. With regards to cash, we stand at 14.3 million pounds. Again, a little bit better than what we had previously reported on. So overall, a good, strong performance, and we have enough cash to continue to fund our growth, and we are reiterating our 2026 guidance.
So one of the big strategic moves that you did last year, and I know we spoke about it a few times, was the acquisition of CRS and obviously Cryostore. So how are those integrations going? Was there anything you can give us any insights? I suppose the question is, what are they bringing to the wider hVIVO offering?
So, I mean, that's a good point, right? So I think before I go through on how well they're progressing, I think it's key to reiterate why we brought them on. Why did we acquire this company? So Cryostore, a really nice small niche company in Greenwich, in London, provides biobank services. We have a lot of samples, and it's a great place to store biological and clinical samples on a long-term basis, and is generating revenue as we had anticipated, which is really positive for the company. CRS is really key also because previously we had a consulting arm that worked at the preclinical stage, so before drugs went to humans, and then we had the human challenge trial aspect, which is phase 2, so the second stage in clinical human experimentation. Now we have CRS who do phase 1, so now we have to complete all the pieces in our jigsaw puzzle, if you will, so we can take a client from preclinical consulting all the way to phase 3. So it means that we can actually take, especially small, mid-sized biotech, help them design the formulation of their product, help them design the clinical development plan, run their first in human clinical trials, and then also do their proof of concept phase 2 trials. So it really kind of, I think, transforms us to just being a human challenge trial CRO to being a full service CRO partner for our clients. So they're the key reasons. Both companies are fully integrated. CRS, in fact, had a really impressive Q4 where they have started to generate cash. So all in all, having a greater variety in the phases we're able to provide services in, greater variety in the therapeutic areas, and then also being multinational means that we are much more stronger than we were 12 months ago.
Well, as you touched on just then, Mo, 2025 came with its fair share of headwinds, let's say, and both macroeconomic and sector specific. How did those challenges affect hVIVO's operations and strategy? And to be fair, they're in the past, so more broadly, what's your take on the market sentiment right now?
Yeah, so 2025 has been difficult for the whole industry. I think that's something that's been reported many, many times, and we were also suffering as part of that. And for us working in vaccine field, I think it added an extra bit of spice to what happened to us. The biotech funding was also something that was depressed, and that also issued kind of challenges for us. But right now, I was at the JP Morgan conference in San Francisco earlier this month, and I think what people really kind of describe is a cautious optimism. There seems to be more activity, more clinical trials being conducted, and also more M&A activity. So one of our key clients, Sedara, for example, were acquired by Merck for $9 billion, based partly on the work that we had conducted from the human challenge trial all the way to end of phase 2. So all that money, of course, gets reinvested into other areas. So that really speaks really well for infectious diseases going forward. But I think the key difference for us right now is that we are not one-trick pony. We can offer more services than just doing human challenge trials in infectious diseases. So we have spearheaded strong growth initiatives in respiratory studies. So, for example, phase 1, phase 2, and phase 3 studies in that indication. Cardiometabolic is another area that has been kind of brought to the fore with the acquisition of CRS. So Dr. Thomas Force is a KOL in endocrinology and is one of the key industry leaders in helping customers design clinical trials in obesity and diabetes. And having him on our kind of books is really kind of a strong indicator how well we do in this area. So I think we are much more resilient than we were 12 months ago, and we are right in the right indications and the right phases where we're seeing strong growth in the therapeutic areas that we are currently participating in.
Well, you used the term there, a sort of one-trick pony. And I suppose one of the terms a lot of people look for, especially in your industry, is future-proofing the business. So I suppose my question is, how is hVIVO adapting to ensure you remain resilient and competitive moving forward?
So we've restructured our company into 4 key service lines. So clinical trials, so this is one phase 1 to phase 3 clinical trials. Human challenge trials, which is the basis of hVIVO, 2 or 3 years ago. Laboratory services, which apply to all the clinical trials that we run, and also consulting services. So that means that now we have 3 standalone service lines that we can provide our customers to. But the key thing is these service lines provide customers with services across the paradigm of clinical development. So from preclinical to end of phase 3 or marketing authorization. So that gives us the resilience that you mentioned. And our sales pipeline that we have now is still strong. And I've said it's strong a number of times before, but there are a couple of key reasons why it's different. One is that human challenge trials no longer dominate the sales pipeline. It is part of the sales pipeline, and we have some really good opportunities like Iliad, for example, still in our sales pipeline. But the other non-human challenge trial portion of the company that we have contributes strongly to the sales pipeline. That's one thing. The second thing that we've seen recently is there seems to be more momentum, more progression in developing these opportunities into conversions and into contracts, which has not happened historically. We've had really good sales pipeline, but deferral of decisions. And one of the key changes we're seeing right now is that clients are seemingly making more decisions. I think this is backed up by the cautious optimism that people have been talking about recently.
Well, so one of the things I was going to talk to you about, and I appreciate you, it's difficult what you can only so much you can tell me, was the sort of the sales pipeline on the funnel, but I'm certainly getting the sense that you're quite positive about it. So I suppose finally then, looking ahead into 2026, what can investors look forward to? Is there anything in that pipeline or even, the business pipeline that you're particularly excited about?
Oh yeah, there's a number of large opportunities, especially in the human challenge trials that we are looking to convert in 2026 that we are very positive about. There are also a number of phase 1, phase 2 opportunities that are looking strong on top of the lab, and the consulting arm is also doing well. So having a variety portfolio of services means that we're able to diversify across different groups within the company and convert that sales pipeline into revenue. But for 2026, I think people need to understand that we have laid the foundation of a diversified full service CRO. 2025 has been challenging, but we've come through it, and we've shown that we've still been able to deliver a very strong trading uptime. We're still very cash positive, and we expect to use that cash to continue our growth mode. But as our investors and shareholders, we expect to hit our guidance that we issued for 2026 last year, and I expect us to grow across all our service lines.
Well, Mo, it's always great to speak to you, and I really appreciate your insights. And I'm delighted to hear how hVIVO have not just weathered the environment, but you've taken some bold steps to grow and innovate. So we'll all be watching with interest how 2026 unfolds.
Thank you for having me on. Appreciate it.
Thank you.